So you have a baby in your room. Where should you start? What should you start doing, especially when you don't have a lot of experience? So there are three things that you can do. And this is exactly what I do. I kind of pick from one of these. So the one thing you can do, especially with a birth that has lots of trauma, baby's got stuck, something was applied to the head, baby didn't get that time with mom right after being born, injuries, traumas, okay? You can treat that first because you actually won't get much physical biomechanical stuff resolved until you do a little bit of work on that emotional trauma. And you do that by inhibiting the sympathetic system or trying to boost the parasympathetic system a little bit and feeling where there might be some hard muscle tone and trying to inhibit that. You'll do balancing work, like balance your sacrum with the cranium. You'll feel around and the body will start to tell you what it wants. And you just like take that time to understand and connect with your heart to what the baby went through, whether they're screaming or not. They can tell that you're connecting to that frustration, pain, anguish, nervousness, and fear. So meet that, and try to see where you can resolve something a little bit in the body. If they're not doing well on the table, then do this work in one of the parents' arms. The baby can be in the parents' arms and get some of that work done. That can resolve at the beginning of treatment. It might take a whole treatment of in and out, just trying different things. But when I had to do that for basically the first treatment and couldn't get to much else, parents come back and say there were a lot of changes, just babies seem to sleep better. That's great. Babies really need to sleep good. Another option, if you really don't know where to start, maybe there's lots of things going on. Maybe your confidence is low. Maybe you're just not sure. That's okay. Just do a general treatment. And there's several different things you can do there. You can just, number one, open diaphragms. So check the pelvic floor. There's a little picture I'll show you later on where I'm doing pelvic floor work with the diaper on, and it's not too invasive. It's just close to the pelvic floor. I'll show you that. And then obviously, do some work on the respiratory diaphragm. Great way to do that is with the baby seated facing away from you. They can still see their parents, and parents can hold their hand or engage the baby with their expression. Or you can just do treating two or three of the most obvious things, So that can be, like a rotation in the pelvis and then bounce out shoulders and then just release a little compression the OA. Done. Let them go. If it took you half an hour to do that, because you have to keep stopping, starting, that's fine. That's fine. Doesn't matter. 3 things done, go, come back next week. Another thing you can do is just a stretch routine. So you can, maybe do flexion extension of all the major joints, flexion extension of the spine, do a little bit of a mini side roll, get the baby on each side and do a little side roll and open up each pec area and try to get a little bit of stretching in the head and neck and see what happens. That can prove to have some really good results when you're not least expecting it. So going back to the thorax, I've mentioned that a couple of times. There's several things you can do there. Just find some little spots where there might be some ribs approximated. It's hard to feel those individual ribs, but you can definitely feel when you have 2 fingers somewhere that there's no movement. It feels hard. It feels like a hard hoop. Have them side bend, you're holding them and you're getting them to open and bring their arm into it and try to get that up to open those up. And once you do that, that brings balance to the shoulders and lets you keep going upwards. So if you're not sure where to start, you can start at the thorax for that. Of course, it increases all the circulation, increases all those breaths. They take so many breaths per month, 3 million, that's a lot. And of course, it normalizes the thoracic and abdominal pressure gradients, which is important because you'll get the complaint a lot that baby's grunting too much, fussing a lot, and spitting up a lot. Well, if those pressure gradients are working good, then hiccups calm down. They can pressurize to burp, fart, and have a bowel movement better. And then they're happy, right? And so's parents.